What's up, guys? Dr. Robert Fredrickson here with Fredrickson Health Solutions. Today I am here to do a video or a product demo on Everlywell's at-home lab testing video. So direct-to-lab consumer testing has been around for a long time. I have been using them extensively with Any Lab Test Now, LabCorp, and Quest Labs. Those are labs that you typically go into and get a blood drawn through venipuncture. Now, what makes Everlywell a little bit different is that you can get the test in the comfort of your home using a dry spot analysis. So there's a couple advantages to direct-to-lab consumer testing. One is that you get tests run that you think you need, that you don't traditionally get on a traditional lab panel, like the one you get when you get your physical. Usually that's going to be like a complete blood cell counts, thyroid panel, cholesterol check, etc. But they're not going to get to advanced numbers. They're not going to look at reverse T3. A lot of times they never look at vitamin D, and a lot of times they don't look at inflammation like CRP. So I was going to do, a direct lab consumer test for myself. I was going to look at my vitamin D levels, and I was going to look at my inflammation levels. I wanted to see what my CRP levels were. And I've already got my blood run twice this year, and these markers were not included. So I'm doing a separate lab test to figure those numbers out. So a couple of advantages to this is one, you get to do it at the comfort of your home. Dry spot analysis also allows people who are scared of needles, scared of getting their blood drawn through vials, that eliminates that altogether. And also 2020, we're doing social distancing. So this is a good way to practice at-home lab testing without actually leaving your home. And so there's been dry spot analysis has been around for a long time. They first started doing like one of its precursors in the 1860s. And then in the 1960s, they started using it extensively in babies and newborns. They do a heel prick and a finger prick test to check for metabolic diseases like the dysfunction of the thyroid gland. A lot of times you don't want to use a full vial of blood on a newborn infant baby. So neonatology units, they use this a lot, and it's been around for a while. A lot of people have criticized the validity or the accuracy of dry spot analysis versus whole blood venipuncture test. But a lot of the research I've read, for some markers like vitamin D and CRP, you're getting pretty reliable data. And so I can't, vouch for all different markers for dry spot blood testing versus venipuncture. But for a few markers, like I'm sure Everlywell's done the research as well, but you can look at a few different markers and actually see hey, this is a 95% confidence ratio compared to traditional serum venipuncture. So dry spot testing through Everlywell. Everlywell, if you guys need a background, Everlywell is a company based out in Austin. You've probably seen them on Shark Tank. The owner, Julia Cheeks, actually got a $1 million investment, the highest amount of investment for a female entrepreneur at the time. Everlywell's been growing in popularity. I think there's over $65 million in sales last time I looked. And that's great because people are advocating for their health. And a lot of times that you go to the doctor and you get these lab tests run and you're not feeling good, but the doctor says your labs came back normal. And so you're like, well, I don't feel normal. A lot of times the reference range is a lot wider and it allows for a lot of variance. And so if you tighten that window up and you look for some markers, like vitamin D, for example, and you look for some markers that are a little bit in more the optimal range, not just the adequate range, you'll find that you'll actually be deficient in a lot of areas. So vitamin D deficiency, it's pretty rampant in America. Traditionally, we need levels above 30 nanograms per deciliter. Now, 7% of Americans are actually below that 30. If you're below 20, you're deemed deficient, and usually you're at risk for rickets or bone deficiencies, osteoporosis, etc. So optimally, though, studies have looked at all-cause mortality. They found that people who have vitamin D levels anywhere from 40 to 60 actually have the lowest all-cause mortality. So that's a big deal. And I'm an advocate for optimal health. So vitamin D, in my opinion, a lot of the research I've read is anywhere from 50 to 75. And we know vitamin D is a lot more than just bone health. It's immune health. It's a hormone that we produce in our bodies. A lot of people have factors that don't allow them to absorb vitamin D. A lot of people say, well, just go out in the sun. Don't wear sunscreen 20 minutes. And I do advise that, but as we get older, it gets harder and harder to absorb vitamin D from the sun. If we have skin differences in our colorations, sometimes that is a factor as well. Then also genetics. There are specific genetic polymorphisms, for example, that don't allow you to absorb vitamin D from the sun. And funny enough that they Everlywell included vitamin D in inflammation because CRP is a marker of systemic inflammation, and having lower levels of vitamin D has actually been indicated to have higher amounts of elevated CRP.